Okay, so we are transitioning into the clinician panel. Thank you so much for those great questions. So we have a few minutes. Again, my name is Martha Walter, and I'm a psychologist here, and I'm going to serve as the moderator. We have several questions that individuals have submitted to us, either today or in advance, that we'll be getting to as many as we can. I would, though, like for, I know you've met a couple, but you haven't met everyone, so I'd like for each person to be able to introduce themselves and their role.
James Lee, assistant professor in psychology and a Weissman investigator.
Danielle Scholze, I'm a developmental pediatrician here at Weissman.
Lisa Zerbakken, I am a treatment coordinator here with our Weissman Autism Treatment Program.
And I'm Amy Lyle, I'm a social worker and family navigator.
I'm Haley Crane, I'm a psychologist. I work in the Autism and Developmental Disabilities Clinic. I also work in our newborn follow-up clinic and then work on the research side in the clinical translational core.
Thank you. So our first question has a few different parts, and I'm happy to repeat any of these, but I'll read all of them if that's okay. So the questions are, who is all on your multidisciplinary diagnostic team for making an autism diagnosis? Can you tell us what the process is? Does the patient meet with each discipline individually or as a group? Who makes the final autism diagnosis determination after each individual discipline completes their part of the assessment process?
So this is a really great question, and the process starts from a referral from an individual's primary care provider, and that referral then goes to our triage team, which is made up of our clinic coordinator, who is Paula Perez, and our clinic director, which is Lindsay McCary. And sometimes the referral question is not always clear, so they might ask one of the family navigators, and I'm one of those folks, to reach out to a family to learn more about what the concerns are. So sometimes people get a call from us on that end just to learn more about what the questions are. The triage team are the ones that make the decision about who it makes the most sense for a family to see for an initial visit. Some families come for multiple visits to the Weissman Center, and I'll let Dr. Crane talk a little bit more about that. Before the initial visit, we make an effort to reach out to every family. The family navigation team makes what's called a pre-visit phone call to learn from the family's perspective what their major concerns are, what their questions are, help them know what to expect the day of the appointment, how to best prepare their kiddo, and listen to any concerns that they might have about even just the day of what to expect. Then family navigation is available throughout the process, both during the diagnostics and then after, to make sure that families are connecting to the services and supports that they're looking for and that might be recommended.
And I think Amy touched on something really important, is that through our diagnostic process, we want to make sure that we're really individualizing it for the individual that's coming in. So not every child's going to receive the exact same process. Because we're able to have family navigation call and get information on them, we want to really make sure that we're addressing their unique needs. And so our multidisciplinary team includes audiology, occupational therapy, speech-language pathologists, developmental pediatricians, psychologists, and social workers. And so we really look at it as a team approach that we're able to, depending on the needs of the individual, then they're given an appointment slot with the provider that best fits the question that they're asking. And many times then, I think the last question was, who gives that final diagnosis? That's typically a developmental pediatrician or a psychologist that then will be able to provide feedback. The really nice thing is that we have family navigation embedded in our clinic. So on that last visit, we really want to spend time talking to the family, giving them resources, talking about the diagnosis so that we can support them so that they can go on to that next step.
And I think just one follow-up note is that many families may meet with individual providers alone, but we do have some combined visits. So depending on who's coming and what is most helpful or seems to meet the needs best, there are some combined visits. So for example, I have a combined visit with speech and language, which is wonderful. So it's psychology and speech and language. Dr. Crane has a combined visit with a developmental pediatrician. And so there's some variability and flexibility in terms of what we can offer. And what it's really, again, I think to echo, based on what seems like it will be most helpful for the individual person and family. Okay. All right, so our next question is, how do you determine which treatment goals to address first? Do you have a specific treatment you subscribe to or would recommend we learn more about?
Hi, so I can speak to our Starting Together treatment program here at Weisman. The first steps in deciding what treatment goals will be appropriate for your child is you will meet with our providers. So our providers are board certified behavior analysts, myself included, and we also have a social worker on staff. So you'll meet with the providers, we talk with the parents, and any of our Growing Together programs, the individual client receiving the treatment may also be included in those treatment development of those goals, depending on their functioning level. And within our program, we will decide with parents as well as using a variety of developmental assessments to determine which goals are going to be appropriate for the child. In our Starting Together program, we use the Early Start Denver model, and that also contributes to the treatment goals that we decided with the family. It's highly individualized and dependent on each child and each family and what's really the most meaningful to that family of what they want to work on for their child. Is there another question?
I think you touched on them, but just do you have a specific treatment you subscribe to or treatments you'd recommend we learn more about?
So here at our Starting Together program, we follow the Early Start Denver model. There are a variety of treatment models out there, and there's not one specific treatment model that's going to work best for each child. So you're really going to have to work with the providers in your child's life to determine which is going to be the best treatment model that works for our child. Early Start Denver model is a more naturalistic approach to autism treatment and still uses the principles of applied behavior analysis along with that. Really, if you're looking to determine what's the best fit for your family, is working with your pediatricians, your social workers, everyone on your child's treatment planning team, as well as board certified behavior analysts.
Our next question is, are there any links between excessive or increased electronics usage and increased ADHD symptoms?
Okay. The first thing I'll say is correlation does not equal causation. And so while there might be some cases where we've seen a relationship between increase in technology usage or watching television and maybe more inattention or hyperactivity symptoms, it may not be a necessary cause of those symptoms. The research around technology and media consumption and ADHD is, I would say, not very well established right now in terms of leading us to any one conclusive, definitive statement that we can make about it. And in fact, what I will also say, and maybe some of the clinicians on this panel can support this, is that technology and media consumption might actually be beneficial in some cases with children with ADHD, that it can be quite useful as a tool to encourage positive behaviors. And by limiting the consumption of certain things like their iPad usage or video games, that could actually turn things back and make things a little worse in some cases. So I would definitely caution against going too far in one direction based on anecdotal evidence that all media consumption and technology usage is bad. Certainly there could be cases in which it's may not be beneficial for a child who already struggles with attention, but in many cases, in some cases clinically, children with ADHD can respond quite well if you give them a structured time with which they can use their media devices, and it could eventually even lead to better outcomes in other domains of their behavior. So not one way or the other, and I think the research isn't very clear anyways.
Does anyone else want to comment on that? Or?
No, exactly the same thing. I mean, I don't think we really know, but definitely the correlation versus causation is huge. There's so many times that people talk about a correlation and this is associated with this, and that does not mean it's a causative thing. You can pretty much find a correlation between just about anything if you really try. So we really want to be very careful about how we interpret those studies, but the research really isn't there yet.
So I think we have time for at least one more question, which has two parts. So how common is it for those with anxiety to also have ADHD? And how are these individuals treated if stimulants can negatively impact those with anxiety, but stimulants positively impact ADHD?
That is a really good question. First of all, it is really common for people with ADHD to also have anxiety, and vice versa, people with anxiety also to have ADHD. I kind of always laugh. My son has the AAA, that's what I call it. So my son has autism, anxiety, and ADHD, and I feel like, you know, it's like there's so many people out there that also have that experience of having a child or being an adult who has all of those things. So yes, we see it a lot. There is also a lot of question as to whether, you know, what comes first and what leads to what. So there are definitely a lot of thoughts about, you know, does ADHD lead to anxiety due to the environmental stressors and behaviors? And I do think that's a huge contributor. So I think that oftentimes kids may start off with ADHD but later develop anxiety just because there's so much pressure and so much stress. And so I think, you know, there's that huge overlap. So yes, it's a huge challenge. When it comes to treating with medication, we still do typically try stimulants first. So usually that's where I start with. I always also very much think about what is causing the most impact. So if a child has both anxiety and ADHD, I'm going to spend some time trying to delve into which one is really causing more problems. Sometimes it's not the ADHD that's causing significant challenges. Sometimes the anxiety is the bigger problem. And if that's the case, I'm going to go for treating the anxiety over the ADHD. So I typically do try stimulants. There are different ones that may be better tolerated in some kids, so sometimes I'll choose specific stimulants, but there are alternative medications for ADHD. Alpha agonists, so a lot of people have heard of guanfacine and clonidine. Those medications can be used for ADHD and don't tend to exacerbate anxiety. They're not used specifically typically to treat anxiety, but they can be a good option. Strattera is another one that sometimes is used. There's some questions as to how well that works in patients with autism, but that being said, I have had some good luck with Strattera, which is another non-stimulant treatment for ADHD that doesn't tend to exacerbate the anxiety. So that's usually my go-to. So we are going to transition now to our next panel. Thank you so much.